Hello, everyone. I'm Tony Masso. I'm a newly engaged strategic advisor to Virta. I'm excited to be with Virta because it's a transformative healthcare company. I've also been a board member of at least a dozen healthcare companies. I'm a strategic advisor to several. When Sami Inkinen called me and he said, "Hey, we want you to think about joining us," and I looked at what Virta does, which is dramatically change the healthcare practice of people with diabetes, to get them off diabetes, to change the healthcare dynamics of an entire population, and to make Americans healthier. And it works. So, health plans today all have some mechanism for diabetes management. Usually, it's an internal mechanism. The medical director and this medical director's staff and the systems of hospitals and provider groups all know that diabetes is a problem, but they're really not doing enough. They're basically measuring blood glucose levels. They're prescribing more and more meds, not unusual for a type 2 diabetic to be on 3 or 4 medications at the same time while being overweight and while being occasionally contacted by their primary care physician, usually on a monthly basis. So I'm very excited about Virta's reversal treatment of diabetes because it's a scourge in America. So to reverse diabetes with Virta helps all of us and gets Americans more healthy. The weight loss is tremendous, usually about 30 pounds after 2 years, $10,000 reduction in medications, usually 4,900 or so. In the first year alone, people drop the use of insulin and oral anti-diabetes medications. So I think it's a wonderful thing to do versus what's happening now. Stick your finger, give your blood glucose reading, online to your doctor who's not going to call back for a month or so. I don't think that's the way to treat diabetes. So health plans need to recognize their people who have diabetes are not getting better, and it's a progressive disease. Not to mention the fact that they should do it because it's a social need for their patients to do something for them. Of course, economically, it's in their best interest because clearly there's a great deal of healthcare savings. Not to mention the difficulty, especially in COVID today, of being more at risk, 50 times more at risk of having a severe hospitalization or a death with COVID if you have diabetes versus someone who doesn't have it. Health plans ought to do it because, first, it's the right thing to do for their patients. Second, it suits them economically. And third, if they want to be community stewards of people that they say they want to get healthy in all of their ads, and when they market to employers, join our health plan because we take care of our people better. Well, you've got to walk the walk. You just can't talk the talk.